And good afternoon, Freedom family. It's time for you to integrate and circulate with us here on 106.5 Freedom FM for today's edition of Issues, St. Kitts and Nevis. I'm Juni Liburd, your host. We're going to be here until just about 3 o'clock. My guest this afternoon is the Honourable Marcella Liburd, Minister of Health, Community Empowerment, Culture, and of course the Minister responsible for Carnival. And of course the Minister responsible for Gender Affairs. Let's say good afternoon to Marcella Liburd. Good afternoon, Marcella. How are you today?
I'm very good, thank you. Good afternoon to the Freedom family and to all of the listeners of Freedom FM at home and abroad.
Excellent. And certainly we reach out and touch our listeners in the diaspora, in the Caribbean and in North America, wherever they are, in Europe, in Taiwan, and all over the world. We have so many people locked in at this time for one of their favorite programs here on Freedom FM, which is the talk show we call Issues. And on this program, we try and deal with the issues and not get into the personalities and abuse anybody or anything. We just want to deal with the issues that currently face the Federation of St. Kitts and Nevis. Now, Marcella, you have been a minister in the government for how long now?
3 years.
3 years. How has it been?
It's been pretty good. It's a learning experience like everything else, and so you learn as you go along, but I think that we've been doing a very decent job in the ministry.
All right. Now, this afternoon you're going to share with our listeners about health insurance.
Right.
I hope that we can also ask you some other questions that from time to time people on the Freedom Wall and people who call in may ask, and also at the end of which you'll take a few calls from our listeners.
No problem.
All right. Now, I want to start off first by just playing devil's advocate before you get into the health insurance, because we've had, within recent times, we've had a couple of callers and emailers talk about the state of the Joseph and France General Hospital, which falls under your portfolio as Minister of Health. One of the things that we've heard them say, basically, is that the resources up there, especially the supplies, are dwindling or non-existent. For example, they say that there's no bath towels and no pillowcase and no sheet, and how they have to bring these things, and that you get the impression that on the one hand, from the outside, it looks like a state-of-the-art hospital, but from the inside, they're saying that they don't have all the supplies that they would need. Is there a problem with supplies at the JNF?
I don't think there's a problem with supplies at JNF. Like any other institution, there are times when you may be low on one or two items, but generally, we have the resources up at JNF. But again, as usual, you will always hear stories. I mean, we hear some stories sometimes that we wonder sometimes if it's JNF they're really speaking about.
Right.
But that is how it is. But I would like you to understand that the life expectancy, to show you the output of what is happening up at JNF, life expectancy, the last statistic we got for us, went up to 75.
75 years.
75 years. In 2010, it was 73, and in 1990, it was 69. So you can see how that is going up. In terms of maternal deaths, it's almost a rarity up there at JNF. We've had about 3 maternal deaths in the last 5 years. In terms of the death rate, because sometimes when you hear the stories, you would think, we have a death rate which vacillates between 3 and 4%. And if you were to check statistics worldwide, you would see that is probably one of the lowest, if not the lowest, in terms of death rates in the world. And so I'm not telling you that everything is fine and dandy up at JNF, but certainly we provide quality service up at JNF. And there are times when you're not going to have something or some other thing. There are times when you have that. But generally speaking, we're well resourced up at JNF.
I want to move on quickly to an area of health that, especially when it comes to young people's health, more and more for young people are getting obese. More and more for young people seem to be coming down with high blood pressure, hypertension, strokes in their 30s, and cancer. And one of the things that we have heard is that, there's nothing there to deal with, say, cancer and high blood pressure and all of that. Speak to those issues for me, please.
Again, as I said, most of this is just, people with their agendas, really, most of it. We don't have an oncologist, but we do have people coming through every now and again to deal with cancer patients, and we do have doctors like Dr. Wilkinson who deal with cancer patients, and private doctors as well, and they're well looked after to the extent that we can, and then we try to get them overseas, because we do have an arrangement. The government has an arrangement with, for example, Trinidad, where they can go to get the special needs for persons who suffer from cancer. But we do have that arrangement in place, and that is something which we have to look to. And that is one of the reasons why we are so adamant and have gone so far in terms of trying to get this medical health insurance going forward. And that is one of the big things that we are working on now. We have gone through it. We are almost at the final stages of it. And I would really like to inform the public as to what we have done so far and where we are at.
Okay. Before we do that, stick up in there, now sugar, blood sugar and so on. Right. People have to get treatment, and we fear that we've heard that you don't have the machines, dialysis machines there to deal with the sugar and so on, that people have to go overseas for this and so on. What's the state with that?
Well, only in terms of the hemodialysis. And I am happy to report that as we speak, our hemodialysis unit will open in about April this year. As a matter of fact, we have all the machines in place. There is a room where there are all of the resources.
They're there already?
They are ready. They're here actually on the ground right now. We have a nephrologist who is the expert in hemodialysis. We have 2 nurses who are trained in hemodialysis on the ground. They're training 30 of our nurses beginning February 21st, which is a week or so from now. And so that unit will be up and running in April of this year. The hemodialysis, which is the last piece of that dialysis puzzle.
All right. Now, you mentioned before I asked you to stick the pin about the insurance,
right,
the health insurance. Tell us about the scheme that you have in mind and how will it be implemented.
Right. Now, as you know, very many countries have tried to implement this and they have not succeeded, because like everywhere else in the world, if you take the US, wherever you go, health costs are escalating.
Yes.
And as health costs escalate, you would find that people, especially low-income people, are not able to cope with the costs of health. And that is why, go back to your thing about obesity, we are appealing all the time for people to try to eat right and so on, because a lot of this is really self-imposed. It's your diet, it's whether or not you exercise. I mean, nobody could legislate these things. You would have to take a decision to look after yourself in that regard, right? But when it comes to health costs, as I said, we have no control over the escalating cost of health all over the world. And so one way to try and deal with it, because the costs to any government anyway is unsustainable. That's why the US was debating that the other day. They cannot sustain, a government cannot sustain the payment of health costs for everybody in the system. Right now as it stands, the government, as part of government policy, undertakes costs for all children up to, I think, age 16 and for people over 60. Also, they absorb the costs for all chronic diseases, which includes things like high blood pressure, diabetes, disabled persons, indigent persons, all chronic diseases, along with these other persons like indigent, etc. And so we had to look seriously at how we can make health costs sustainable and make sure that everyone, regardless of your income level, regardless of who you are, that you're able to access the best quality health if you fall ill. And that is the important thing about the medical health insurance.
Does this apply to just public servants or to the nation at large?
The nation at large. That is what we're looking at, not just public servants. But we started where we thought we had the most impact, which was with public servants, people who work for the government. And so everybody working for the government now is covered by medical insurance. once ago some persons weren't covered. Now everybody is covered, whether you're non-established as they were called, or whether you're pensionable. Well, everybody's pensionable now, but non-established as opposed to people who, you know, in the civil service proper, all public servants are covered by this insurance. And as of August 1st last year, that insurance was upgraded so that now all public servants are covered for example, air ambulance if they have to.
So they would have to foot a percentage of the cost?
No, they're covered,
totally,
completely covered. If they have to go out of the federation, they are covered by air ambulance.
That's public servants.
Public servants, right, covered by air ambulance. Also, the old policy did not include dental, health,
that's true,
and eye.
So that's now
part of the new policy. As a matter of fact, it covers dental, it covers eye, it covers mental. That also was not part of the old policy. If you had a mental illness, you were not covered. Now you're covered. It also covers HIV, okay, under the policy, because we say no discrimination. No discrimination. Everybody must be covered. It also covers an annual checkup, because we believe that where we need to go is preventative. We don't want you to be sick, we want you to be well. And so we're saying that we are covering an annual checkup for all public servants so that they could stop themselves from getting sick, or at least from getting advanced sickness. Because what happens now, invariably when someone shows up at a health center or the hospital, usually, as you know, the cancer, the whatever it is well advanced because there were no previous checks. So now we're saying an annual checkup will be covered. Also, it goes up to the age of 75. Under the previous policy, once you left government service at 55 or whatever age you retired, that was the end of your health policy. Now, the new policy takes you up to 75 years. Another improvement under it has to do with what is called catastrophic illnesses like cancer. Under the old policy, you were allowed $250,000 if you became diagnosed with, say, something like cancer. You would know, as someone who are close to persons who suffer from cancer, that this really, even though it may sound big, is small based on the types of treatments and so on, if you're especially more advanced in terms of the diagnosis. And so this new policy now, you can be covered for up to $750,000 over a 3-year period. Formerly, it was $250,000 you diagnosed. That's it. $250,000, and that's the end of it. Now it's $750,000 over a 3-year period, and at the end of that 3-year period, it is reinvented, and the $750,000 would start over again at the end of that 3-year period. So you would see that for the benefits, are vast benefits covered, and this covers, of course, about 5,000 people.
Now, what is simply amazing about what you've said is that there's no cost to the civil servant or the public servant. Now, SJA, writing on the Freedom Wall, says, how feasible is this insurance expenditure, especially as the public servants don't contribute to it? As a civil servant, he says, I believe in paying my fair share because health is expensive.
Well, I appreciate the view, but it's not everyone who will be able to make that contribution, and I appreciate the view of the person on the wall. And so we looked at that, and so what we do, we have bought into a policy of insurance where you pay a premium of something like $4 million yearly to cover public servants under this policy.
Now, when you expand it to include, well, you said that's the intention, to expand it to include the nation at large, everybody.
Right.
Would persons who don't work for government pay a small portion of this cost, or it's going to be free to them as well?
Well, the mechanics of that, we're still working on. But let me tell you where we're at. We had some research, data, and so on presented to us. In addition to the public servants that we spoke of, which is about 4 to 5,000 of them. There are many persons, I don't have the number here, but many persons covered privately under their own workplaces. So there are many workplaces who cover their employees for health benefits.
Yes.
So in addition to that, you also have that number of persons who are already covered for health insurance in the private sector. And again, we want to commend those workplaces that do that. So you have that. Then you have what we call sometimes the indigent and the unemployed. These are people who usually the government covers through social services. So they have an idea of the number of persons who would come to be covered under that particular section. Now, when the data is presented to us and you exclude the persons who are covered by government, the persons who are covered privately, we are left with about 30 to 35% of the population who don't have any form of insurance. They're not covered privately. They're not covered on the jobs. There probably may be some unemployed people, indigent people, people at the lowest end. They're not covered. So that really is our target at this particular point in time. How do you cover this 35% of the population that's not covered at the moment? One of the things that we have looked at and seriously pursuing, as a matter of fact, the brokers are to come back in, I think, is next week to deal with that aspect of it, is to take the amount of money that we are using to cover them currently, because as the system is now, if you're going overseas, for example, as someone not covered by insurance and you don't have it, the maximum amount you can get from through social services is $5,000 right, per person. $5,000, as you know, is not a very large sum. That is the assistance that you get at this particular point in time if you're traveling overseas. Usually helps to buy a ticket, to help maybe with some treatment depending on what you're diagnosed with. We're saying if we take that amount and take out an insurance, as we've done for the people in the government service, for that section of the population, then they too will be able to get greater benefits and not be limited to the 5,000 US, but be able to access greater benefits from coverage of an insurance policy similar to what's in the public service for the indigent and those at the lowest end of the social bracket.
All right, my guest this afternoon is the Honourable Marcella Liburd, Minister of Health, Culture, Community Empowerment, and Gender Affairs. Now, there's an emailer here says, Juni, tell the minister the issue isn't so much that people are not choosing to eat healthy or right. The poorer class simply can't afford to. I disagree with that. But anyway, for instance, one may have to choose between broccoli and rice. Which do you think they would choose if monies are not enough to buy both? The rice, of course, because it lasts and stretches longer and is more filling. Is it that poor people can't afford to eat right? Because I
don't believe so. I really don't believe so. And also, from social services standpoint, we offer food baskets to persons who are indigent. And we try to encourage them to, you know, vegetables and so on, to eat chicken. You can have chicken and vegetables, you know. So I really don't believe so.
All right.
I don't believe that really is the problem.
Ask the minister for me, says young voter, why there is no warfarin or warfarin? What's that? At the hospital. I don't know. All right. Well, young voter, perhaps you could specify a little bit what that is, what drug that is, and what it's used for, so that the minister can familiarize herself with it a little more. So right now, this health insurance scheme provides for civil servants. And the intention is to widen the scope of it to include everybody, including civil servants, the families, the general public at large. And so you're looking at to implement this from when?
We think that we could implement this perhaps in the next 2 to 3 months. We're still looking at how to fund it, because that's, you know, is the biggest problem. That's why I said the dynamics with the guy who asks first, and the person who asks first. We're still looking at that. We're seeing some light at the end of the tunnel, So once the people come in, I think it's next week they're coming, we would be able to see how we go forward with the funding for this particular portion of the population to have them covered.
All right. Sweets Up chimes in and says, Juni, in my opinion, foods that are healthier for us are less cheaper than the unhealthier foods, says this emailer. Also, visitor wants to know, ask the minister, when will the government cover civil servants and their family? I'm a civil servant and I'm willing to pay the extra if they would cover my entire family.
Oh, he's talking about the family.
Yes.
Well, that's a different component. As a matter of fact, that is something that is also being negotiated at the moment about dependents. And of course, they will have some small fee will have to be paid for the dependents. It will certainly be less than if they were to cover them outside of the scheme, because it's a bulk. And like all bulk, you get it at a lesser rate. So there will be an opportunity for civil servants to have their dependents covered under the same insurance scheme.
How do you intend to reach out to the population? I know you're doing this by coming in here and spreading the word about the health insurance. Is there an intention perhaps to go into the highways and byways community centers through radio shows, programs, tidbits on the radio, whatever, to inform the public and educate the public what's in store for them vis-a-vis the health insurance plan?
Definitely, and if you saw what was done to do with civil servants, that's exactly what was done. So it's the same system that would be used. Meetings were kept with public servants in all categories in order to educate and inform them as to what the policy offered and to get their input. We intend to do the same thing.
Is there anything else on the public health insurance scheme that you would like to address? Because when we come back after this break, I want to delve a little deeper into the politics of the time, because I'm sure there are people out there who have questions about no confidence motion and unity government and all of that, and looking at the St. Kitts Nevis Labour Party government, which is in power now. So we'll come back and get your thoughts on that right after we take this short commercial break.
From you want energy, well we got the right remedy. Wrong hotel Beverly and Kenny, say a full throttle, we got for everybody. Well, you talking at gear one and nothing happen. Simba will tell you if you hold a full throttle. Your girlfriend a wait and nothing happen. Simba will tell you go hold a full throttle. You full throttle. 16 ounce of raw energy. We have different flavors and each one tastes fine. Distributed by St. Kitts Bottling Company.
The great shipping bargains continue this month with Crowley and Hobson Enterprises. Here's another opportunity to ship your small packages, boxes and barrels to St. Kitts and Nevis at much lower prices all this month. With rates as low as US $55, Crowley can move your barrels and boxes leaving Miami on Thursdays and arriving in St. Kitts on Mondays. It's as simple as 1, 2, 3. 1. Call us to make all the arrangements for pickup and shipping from Miami. 2. Complete your shopping at your favorite stores. 3. Pack your barrels and boxes and we'll do the shipping. Take advantage of the special low prices on Crowley for your barrels, boxes, and small packages. Call Hobson Enterprises on the Bird Up Road at 465-8753, extension 1088. Remember, give Hobson Enterprises a call and get those barrels and boxes to St. Kitts and Nevis.
Nowadays, it seems like personal banking is becoming more and more impersonal. But at the St. Kitts Cooperative Credit Union Limited, our roots are right here. And that's why you're like family to us. We are able to tailor our services to suit your personal and business needs. Our savings and checking accounts, vacation and Christmas savings clubs are just some of the convenient services that we offer. Make borrowing fun and easy with our low-interest loans that allow you to borrow funds without the hassle. You get all this and more when you become part of our family. Call us at 465-2272. The St. Kitts Cooperative Credit Union Limited. The best place to save, the best place to borrow.
All right, it's 106.5, 2 minutes after 2 o'clock. My guest, the Honourable Marcella Liburd, Minister of Health. A few quick observations, Marcella. Friend says, warfarin is a tablet used to prevent blood clots, pulmonary embolus, as it thins the blood. That's what it is. So maybe you want to respond to that. And take a clip. Hi, Marcella. I'm a constituent living in the U.S. I'm so proud of what you're doing, both at the government level and my hometown of McKnight. It's been a while since I've heard about that dialysis. But now you have made it come to fruition. Proud of you, and may God continue to bless you, says Winston in the USA. SKB Check says, Juni, tell the Minister of Health that I had a relative in the hospital recently, and the service that she's painting on the radio was not given. Neglect was what I saw day after day. So unless she's talking about another JNF hospital, she needs to do an audit at the one that she's referring to. Okay, so there you have praise, criticism. Your response.
Yeah, what I would say, with the one with the drug, I wouldn't know anything about the drug to give an answer immediately. I will have to check it out, so that I'll have to check out.
Okay.
I want to thank the person who was commending me for the work that we're doing, and to the caller who got the poor service allegedly at the JNF, I would say to that person, that is one instance. But there are many people who have gotten excellent service. And if the person got poor service, I wish as a minister to apologize. But this must not be used as the yardstick to measure what happens at the JNF, because we provide quality service there. And we've gotten many letters from persons who've been there who have commended JNF on the quality of service that they give up there. So again, as I say, I cannot speak for the person, and I wish to apologize to the person whose service he said was poor. I wish to apologize. But again, we cannot use that as the yardstick to measure the quality of service at JNF.
All right. Now, you're also the minister responsible for gender affairs. What is happening in the Ministry of Gender Affairs? Can you give us an update?
Well, briefly, I would like to mention a couple of things. One, last March, as International Women's Day approaches the 8th of March, we had put together an interim committee of women, because we needed to have a National Council of Women, which we haven't had for a long time. They have been working constantly for the last year, and we're hoping to launch that National Council on International Women's Day this year. They've done quite a bit of work, and so we look forward to that. We also want to have the actual consultations on the gender policy start in keeping with International Women's Day this year. And there's a program called WISE, Women in Small Enterprises, that we're launching this Friday. Now, this is a very interesting program, because when you look at the reports, you would see that women are at the lower end of the income bracket, and even though our poverty numbers are reduced, when you look at those numbers, it's still women at the lowest end. And we always say that women look after the family. So wherever the women are, that's where the children are, that's where the family is. And so the idea behind WISE, which is Women in Small Enterprises, is to try to help women who are in real micro enterprises, like selling trays, these little shops and so on to the side, to give them some help in terms of trying to get them, whatever they need to assist their business.
Yes.
So we will be helping these with some funds, small amounts, but still funds to help them, like to supply their businesses, to maybe buy some stock, buy some equipment. Maybe if you're a hairdresser, you might want a stool, you might want a dryer, whatever it is you would need to help you in your business, that you'll be able to access that under the WISE program, which we are launching on Friday this week.
WISE,
Women in Small Enterprises.
Now, there's also another program launched, I think, by SIDF for young people, I think, for 1,000 people to be involved. How does this affect your ministry?
Well, we have put in areas where we can take in some of these people to help. For example, one of the backlogs we have up at the hospital has to do with the entering of data into the computer. And so we're looking for persons with who have some education in computer, who have certificates in computer, or who have information technology as one of the subjects, so we can get a couple of young people up there to be able to put in that data for us as we try to get our information in the computer system up at JNF.
So that's great with the SIDF assistance that's coming there.
Definitely.
But the WISE program is something specifically geared towards women
in small enterprises.
Business, small enterprise.
Yeah, like trays.
And how will this assist them? Is it that they're going to get some help in their training, in their marketing? They're going to get some finance to help?
They're going to get some finance, and on top of that, they'll get some monitoring, just assistance with simple things as to how they could be more business-oriented. But they're going to get some finance to help them in their businesses, anything that they might want in terms of stock, in terms of equipment, small amount towards them to help them in their businesses.
I think this is good, because just yesterday we were talking about black history and black culture and black pride, and one of the areas that we certainly wanted to stress yesterday was about black empowerment, empowering our own people to take up business, to get into business, to run business instead of working for people. Start your own business, be an entrepreneur, and see how far you can go with training and getting assistance from the government and private sector, or whoever is willing to help, so that you can grow as an establishment and go from strength to strength. So I think this is a good boon in your cap. I mean, in making this kind of inroad into poorer folks, the poorer black ladies who are there out there with their trays and their little shops and so on, to give them a little help up the road along the way. So I want to congratulate you on that. Now, it's just about 9 minutes after 2. My guest, the Honourable Marcella Liburd. Let me see if there are any comments coming in that about health. Okay. All right. Now, okay, that's good. Juni, the person who called about the warfarin, this is a blood thinner, better known as Coumadin. Okay, poor me, I wouldn't know. Coumadin, but warfarin is something to thin the blood to prevent clotting. You wouldn't know if you have it up there.
I wouldn't know off the top of my head.
Right.
I would have to.
You'd have to research that.
Yes.
All right, now it's just about 9 minutes after 2. I want to talk about the St. Kitts Nevis Labour Party government. Now, it's been going through some growing pains. It's the St. Kitts Nevis Labour Organization, Labour Party, has been around for some 80-odd years. And at this time, at this juncture, it seems as if the road is not so clear in terms of, we've had 2 ministers, one who has quit, in the Honourable Sam Condor, and the other, the Honourable Dr. Timothy Harris, who has resigned. Now, one of the things that the ministers kept saying, former ministers, is that the Prime Minister was not somebody who listens, that, you know, he never listened to them. The Honourable Sam Condor has made that point time after time, that is just, the PM is very arrogant and he doesn't listen to anybody, he knows it all, that kind of thing. And so we've had this defection out of the Labour Party, well, from the Labour Party government, because we've heard that Dr. Harris has said that he was running as an independent. We haven't heard that yet from the Honourable Sam Condor, although people have called in and said that, yes, he has said in no uncertain terms that he's running as an independent as well. But when I spoke to him last week on issues, he was saying that he's still a member of the Labour Party, and that he is the representative, the Labour Party representative for constituency number 3. I want to ask you, did you, as someone who's been in the Labour Party for a very long time and now as a minister, did you notice that this was developing in the party, this dynamic between the Prime Minister and the Honourable Sam Condor and Dr. Timothy Harris? Did you notice that there was a splinter happening, a broken relationship was heading for this crisis now that we have in the country? How do you respond to that?
First of all, I don't know if we have a crisis.
Okay.
I hear people talking about crisis all the time.
Yes.
What I think we have is a situation where there is definitely persons who want to be in charge without following the rules. Because, like everywhere else, there are rules to be followed. For example, if you want to be the leader of the Labour Party, I could only speak to the Labour Party,
right.
We have rules from time immemorial well established, that because we have conference every year, and anyone can run for any post, including the leader. the leader of the party. And so, if someone wants to be the leader of the party, then you run to be the leader of the party. But to my mind, you have persons who want to be the leader, but don't want to follow the rules. And so you try to get to be the leader in some other way.
I see.
And that is the way I see it.
Now, when I spoke to the Honourable Sam Conda, for instance, he was saying that there is no succession plan in the Labour Party. The Prime Minister has been Prime Minister for 17 years. He has been head of the Labour Party for quite a long time, longer than the 17 years. So, isn't it about time? Isn't there something that says, well, okay, I know there's no rule that says you can't run 4, 5, 6, 7, 8, 9, 10 terms, right? But intrinsically, you feel that perhaps other people should get a chance to show their leadership prowess, their leadership skills. Does the Labour Party provide for that?
Yes, the Labour Party provides for that. Ironically, here you have somebody like Vance Amory, who I don't have any issues with, but Vance Amory has been a parliamentarian longer than Denzel Douglas has been. We just had an election in Nevis, and he's gone back to be the Premier.
Yeah.
And I don't hear a similar outcry about how long he's been there and, why somebody else showed me giving a chance to be the Premier. He had 15 years before. He was there, and he's gone back in.
Yeah.
So to me, it really, how long you're there depends not so much on the time frame, but on your ability to produce at the end of the day. And that goes for anything. Politics is no exception. You could be there 2 years and be there too long, because the point is you're not really productive, you're not really producing. So how long you're there has a lot to do with your ability to produce, your ability to ensure that whatever organization you're heading is going in the right direction. So it's not just a question of time, and like I say, time for one person seems to be here, but time for other people, that's okay. I mean, in Simmons' time, Dr. Simmons was there for 4 terms, and he ran for a 5th. And I didn't hear anything about how long he was there and how long he should be there and so on. So to me, a lot of it is, as you know, wrapped up in just the politics of the day and not really anything rational.
Now, the relationship between the Prime Minister and his 2 senior ministers obviously got very strained to the point where they have gone their separate ways.
Right.
Now, could this, because now you have Labour people arguing and fighting with Labour people. It's Labour versus Labour, which gives the opposition a good chance to win an election, because then the votes will be split in certain constituencies. Couldn't this have been prevented? Couldn't this have been worked out somewhere along the line when it was first started? Couldn't it have been nipped in the bud, and so that you don't have this big fracture that you now have publicly with all the problems that has created?
When we did our press conference, that is the other members of cabinet.
Yes.
I think you were there.
Right.
Something. We made the point, and I want to make it again, that one of the reasons why we remained silent until we were called yes men and so on is not because we don't have our views. And sometimes some people who talk about respect, they don't think it's disrespectful to be calling people yes men, because the only people who are right with what they're saying are those who think a particular way. If you oppose them, then you're yes man. That is the thinking. So we don't have any right to our views. There's no respect for us. We're just being carried along as yes people. But we made the point at that press conference that the reason why we remained silent was, one, because we didn't think it was right to be out in the media having this big toing and froing between people in the same cabinet. We didn't think so. And so we took the decision to not to go out and respond publicly to a lot of these things that were being said. Secondly, we were strongly of the view that this thing could be resolved. Just what you're saying. As a matter of fact, at conference, the last conference we had in May, there was a strong move to remove both ministers from the post they held in the Labour Party. There was a strong move from the people to do that. And after much consultation and much pleading, including the chairman, Minister Harris, a lot of people who are adamant that no, this can't go on. We pleaded with them because we wanted to have the unity going forward. And so that was backtracked. That was same thing you're saying. Since that, I know several attempts have been made to have this thing resolved before it reached here. And as far as I know, every time the two ministers involved have refused to show up. So it is not for want of trying on our part. Every time. I don't want to call people's, other people's name, no, but, I'll do it with their permission if they allow me to. So I'm not in a position to call their names, no, but several persons were used to mediate, agreed to mediate. In many instances, they agreed with who the mediator should be. And then they don't show up.
I see.
So, where do you go from there?
I don't know. We have to ask Brad Reddy, sang Calypso about that. It's 19 minutes after talk. I want to share with you a little clip because Minister Harris is now very much in favor of a unity government, which presumably he would head.
Right.
And I guess the Honourable Sam Conner might be part of that as well. I don't know. But these are now Labour MPs, backbenchers, as we say, who want to form a unity government. I'm hoping to have the Prime Minister in here on issues sometime soon, so I have some bigger questions for him. Right. But I'm just sounding out a few thoughts with you and sharing with you some of the thought processes that I have and also sharing what the listeners have. We're going to take some calls right after we play this clip. The Honourable Timothy Harris, in a most recent interview on Win FM, said this. Listen.
Can we continue St. Kitts and Nevis as it has been in the past? Or having regard to the experiences which we now share, we appreciate that we need something new, something better, and something more ennobling in the political marketplace than we now have. Can we continue to run the country with the perception that if you are not in cahoots with the government, then none of those normal supports which you should get from the government will be made available to you? We must ask ourselves, having seen a PAM government at work on its own in coalition with an NRP government, and having seen a Labour Party at work on its own and in coalition with an NRP government, are we satisfied that the country has had its best? Are we satisfied that the level of political tribalism is so high in our country that it is stultifying our progress? Do we need something better? Do we need a more unifying arrangement? And I believe that the answer is yes. It is my wish that I could be a blessing to the people of St. Kitts and Nevis, and that I would want to continue to serve them from whatever vantage point and position the people of St. Kitts and Nevis, having regard to my track record of excellent performance as a servant of the people in whatever way. And I'm not overly ambitious about any posting. Simply to be of service, simply to be a blessing to somebody will be enough for Timothy Harris, the individual. At the end of the day, we have a country to build and a country that is in crisis. Again, to put it again, I'm saying that I'm in the business of service. And if it were that an opportunity was to emerge and there was a consensual view that in that particular position I could add value and vote for the country at a particular moment in time, because I don't want to spend my wilderness years in the partisan political atmosphere. But if it were the will of the people, I certainly will give good consideration to what it is the people are asking me to do. It certainly will be a unity government. because it will be a government reflecting the unity that we could emerge in bringing people of different and differing views politically together. It will perhaps be our best example of that. No more than the unity government in Trinidad includes PNM, but you have different views. You have a UNC, you have a COP, Congress of the People, you have the trade unions, you have different sectors being represented. But yes, you can take Harris, as it were, eject him out of the Labour Party, following the whims of the party leader, but you can't take the love of Labour out of me.
All right, so they heard from the Timothy Harris speaking about unity government and his role as perhaps the Prime Minister in that arrangement. Now, we have a situation in the country, Honourable Marcella Liburd, where a vote of no confidence, the former senior minister challenged Dr. Douglas right here on Freedom FM to bring the vote of no confidence in the National Assembly because he was very sure that the PM would lose it and the chances of setting up a unity government would become very real once that vote is counted. What is your feeling on this?
I'm happy to have the unity government because it might sound very nice out there in terms, people talk about unity. Unity is always a very positive word.
So you don't think that Pam and Dr. Harris and Sam Condor and CCM and so on could team up and form a unity government?
Anything is possible. All I'm saying is that unity sounds very, very nice. But it seemed to me that what they're saying is that Pam really is dead. So Pam cannot form a government. And so they have to have unity. As a matter of fact, when you hear some of the PAM representatives, you would think that the unity government is already, and they really know who in it. So I don't know what the others kind of running for, because they don't have this unity government. They know already who is in this unity government. It sounds very nice. And I noticed that the Honourable Timothy Harris mentioned Trinidad. Maybe he needs to ask Trinidadians how that is working, how that unity government there is working. Only recently, there were the elections in Tobago, and the opposition PNM cleaned everything up. If there's any indication of how the unity government is working, then maybe they need to look into that. This is just purely semantics, and I don't think that the people of St. Kitts Nevis will fall for it, because what you have there are persons with different agendas. The only thing that unifies them is hatred of Douglas. That is the unifying force. And you can't have any government that is based on that sort of spite. Government must be based on positive things. The only unifying force, I say, is hatred of Douglas. They all have their several agendas. I got a WhatsApp today from a friend of mine in the US who was saying to me that on the social media, the divisions were saying to Mark and to Vance, all they must ask for if they're in a unity government.
No.
All they must ask for if they're in a unity government. They're make sure you get this, make sure you get that in a unity government. You only have to recall that in 1980, when we had a unity government, and Nevis got the Ministry of Finance in the person of Sim Daniel, God bless his soul, Pam, who now talking about unity government, were very anxious to get rid of the unity. And that is why they changed the boundaries and changed the electoral system in 94. Because they thought at that time they had an opportunity to win the government by themselves. And the minute they did that, guess what? They got rid of the unity government. They got rid of Sim Daniel. They made him Minister of the Environment. And bear in mind, at that time, we had no Department of Environment. So what was he the Minister of? That is how unity works. It's just a bunch of persons who have their own agendas. Some want to be the historic first division Prime Minister. And Kittitians must be beware.
So you're saying that the only thing unifying these elements is their hatred of the Prime Minister?
Of course. In my humble opinion. That's the only thing that's unifying them. They have their different agendas. And a lot of persons who want to be the Prime Minister within the unity concept. So it's really just a lot of talk, and and they think it sounds good, but really people know what's happening in terms of this unity government. Is just a bunch of persons with their own agendas. Only unifying force.
All right. It's just about 27 minutes after 2. Can you take a few calls, Minister?
Of course.
All right, we're going to take a few calls. The lines are open, 465-6474, 465-0546. Talk to the Honourable Marcella Liburd. Let's go straight to the telephone. Good afternoon, caller. You're on the air.
Good afternoon to you, Juni, and good afternoon to Minister Liburd.
Good afternoon.
Juni, I think you have done a fantastic job with Marcella. Fair and balance. You put it to her.
Thank you. Thank you so much.
Marcella, I think I could call you that.
Terry.
Yes. I'm going to box with you this afternoon, but I will not hurt you.
You could hurt me now if you want, because you can't. You could try.
I like your long try. Marcella, hear this. You said something about assisting, I believe, the ordinary people, whom I believe you may were referring to vendors or some vendors with some help. No. The vendors are scattered all over the place, Minister Liburd. Cannot find nowhere permanently to settle down, to establish themselves in their trade. I'm going to give an example. My sister Ivy were removed from a certain place by certain rich persons who are saying the people, the foot soldier, can't be here and there. But it appears now that an election is imminent. You're calling on the very foot soldier now to say you're going to give them this and that to impress them. Well, I don't like that. I must be honest with you. I don't like that. Secondly, you mentioned something about a unity government, which will come, must come, and I don't see it or anyone stopping it, because there's no such thing as a Labour Party. It is Douglas organization, and I'm going to tell you why. You just warn Kitishans, warn them and be careful. Well, probably maybe you could talk about Patrice as well. He is also Nivision, but yet being a part of a Labour administration. How you equate that? To me, that is partly hypocrisy. Condemning one, well, at the same time, the Labour Party has a Nivision where you just fired two Kittian ministers and split the portfolio with a Nivision. Have a nice day.
All right, thank you so much, Terry. Your response, Minister?
Thank you, Terry, for your call. I know if it's one person would call, it would have been you. I think you're dealing with a completely different issue with respect to where vendors should be, and that's something that we're looking at. That's a completely different issue from what we're offering on the WISE. When it comes to elections, how would we know our election is pending? This is part and program of our program going forward. Elections are due in 2015. So how would we know our election is pending? With respect to the unity that you're talking about and all this hypocrisy, you would not. Anytime Pam and the likes cannot form the government, that's when they look to unity. In 1980, they had 3 seats, they looked to unity. Now they figure they can't win enough seats or winning seats, any seats in St. Kitts, they look into unity. That's not the same thing with Labour. In 2010, we won 6 seats. We could have formed the government on our own. So that is true unity. Yes, we have a division, but we could have formed the government on our own. We weren't scrambling to find somebody to form the government as Pam did in 1980 and as they're trying to do now. Same thing in the former Labour administration. Bratter could have formed the government, but he had Eugene Walwyn, I think it was, at one point being the Attorney General and division. That's true unity. Not where you're scrambling to put numbers together without which you cannot form the government. So what we have is true unity.
All right, it's 2:31. We're going until 3 o'clock. My guest, the Honourable Marcella Liburd. We're going to go back and take some more of your calls, 465-6474, 465-0546. Good afternoon, caller. You're on the air.
Good afternoon, Juni. How are you?
Excellent, my friend. Yourself?
Juni. I'm wonderful, Juni.
Okay.
I have a quick question to ask Minister Liburd. I would like Minister Liburd to condemn what Timothy said in the House of Assembly and his speech about the senator and about people outside here who need help when we're going to introduce new senator. I would like to know if you support what Timothy said or if he did not support it. If Timothy said something wrong, sorry, if Minister Harris said something wrong or Minister Harris said something right. I would like to know how Marcella stands verbally, how she stands on our debt for land swap, right? Also, I would like to know do she think that we should have used the land as first choice for debt to swap, or we should have used some of the SIDF money? Because it's the country money, regardless of what price when it's in, if we should have used some of that to help to pay down our national debt. Because that is our land has been fought for, and has Robert Llewellyn Bratcher asked people back in 1975.
Caller, Juni,
yeah.
Not Patches. Okay, go ahead.
Sorry. Juni, Robert Llewellyn Bratcher asked people back in 1975 to vote to acquire the land. And you know, the thing about it is that the Prime Minister said, no, this is his time now to distribute the land. So I would like to ask Marcella how to think about that. Also, I would like her how to think about increasing the Senator's bill, because what Minister Conde said, look, the constitutional provision for us to have other representative who come in as minister. Let us try that, right? Also, she's speaking about unity. That is the exact reason why the Prime Minister is a very smart guy, you know, and he has advisors who are very smart backing up. The exact reason why that he brought in Patrice Nisbet is because what he know happened now, he expected to happen before. Because, you know, they had dialogue. The exact reason why he brought in Patrice Nisbet's seat, right? So it's a unity government, and that is why he did it. Don't say that they could have formed the government. If they had formed the government back then with the 6, he would have realized something. Now they will have 4. That is exactly why the Prime Minister bringing in Patrice Nisbet.
All right, caller, let's give... Go ahead.
I would like to hear her call on those.
Okay,
what you think about Dr. Harris' speech, if it was for the nation, if it appealed to poor people, because...
I think she has the points. She has the points written down. All right, thanks so much for your call. Minister?
I mean, I think he could answer those questions himself, because I spoke in Parliament. So I was totally opposed to the view that we should not have this bill. And I spoke in Parliament and I said why I was opposed to the bill. I don't think the reasons that were given were enough for the bill not to go through. And also, I have spoken on many occasions around the country on the land for debt swap situation. And I am in favor of the land for debt swap. The effect it's going to have on our national debt. I don't know what the big fuss is about, because National Bank is belongs to us. It is our bank. It belongs to the people of St. Kitts and Nevis, and so the land belongs to the people of St. Kitts and Nevis, whether it's in government control or in that special vessel in the bank, and it's for the people of St. Kitts and Nevis.
But the saying is, the thought we've heard the senior minister say that with the transaction with the debt for land swap, right, the land has now gone to rich people.
But where's the evidence of that?
Yes.
Where's the evidence of that? That is just talk. Where is the evidence of that?
Poor people can't afford to buy the land.
Where is the evidence of that? There's no price set. Where's the evidence of that?
All right, it's just about 2:35. We're taking your calls, and if you're overseas, you can call us at 305-515-3099. In the meantime, let's go back and take some more of your calls. Good afternoon, caller. You're on the air.
Good afternoon, Juni.
Good afternoon, sir.
I just want to ask Marcella a question. You work in the cane field? You have anybody who work in the cane field? Do you understand the torture?
Yes, if you have anybody working in the cane field.
If you give away land, thank you.
Let me just adjust this here so that the people who are calling from overseas can also call in. Okay. All right, I think we have that set now. We have that set. All right, it's just about 2:36. The lines are clear. 465-0546, 465-6474. Let's go back and take some more of your calls. Good afternoon for the Honourable Marcella Liburd. Go ahead.
Yes, good afternoon.
Good afternoon.
Earlier, Marcella Liburd, Minister, spoke about being a part of the yes man. She's a woman. She was elected. How can she include herself in being a part of the yes man when the people put her there? Obviously, the Minister, Harris, was referring to the senators' bill, senators, not elected representatives. So how can she equate being a part of the yes man when the people put her there? Just like how the people put Mr. Harris there, just like how the people put Mr. Conner there, the people also put Mr. Douglas there to do a good job. But obviously, it's of the difference.
All right, come to the point, quick caller, so we can move on. That's your statement you wanted to make? Okay, thank you so much. Let's take another call here. Good afternoon, caller. You're on the air.
Hi, good afternoon.
Good afternoon.
The minister a question.
Sure, go ahead.
I'd like to know if you have anything in place for the Irish Town Primary School, especially the fencing and especially the netball court, because the children are drawn all the way up to the up the netball city.
Okay, so that's your question?
Yes.
All right, Minister?
Well, certainly the netball court, that's one of the projects that we've put forward now under this PEP program. So we're hoping that soon the netball court, not just for the Irish Town Primary School, but for the people of the McKnight area.
Yes.
The girls, older girls of the McKnight area and young women who are interested in netball. And netball is something that, is very, very close to my heart.
All right, let's take some more of your calls coming in right now. Good afternoon, caller. You're on the air.
Pleasant afternoon to you, Juni.
Good afternoon.
And to my friend, the Honourable Marcella.
Good afternoon.
Juni.
Yes, sir. Go ahead.
When I heard the talk about unity government, I did not get the sense that a unity government would come after the next election. That's not the sense I got. I was hearing that it would come from the failure of the present government to have a majority in the House of Parliament as it is now. That is what I was hearing. Perhaps the Honourable Marcella can calm many people's fears about this. Thank you.
All right, thank you, caller. Minister?
I'm not sure what the caller is really referring to, but he's probably hearing one thing. I'm hearing something different.
All right, let's take another call here at this point. Just about 2:39. Go ahead, caller. You're on the air. Caller, you there? Go ahead.
Good afternoon, Juni. Good afternoon.
Good afternoon.
Honourable Marcella.
Afternoon.
It's a little confusing because just a couple of days ago, Lindsey Graham made a statement that the Prime Party is not in for any unity government. So I think these people are way off. Anyway, Ms. Liburd, you handled yourself pretty well, and thanks to you. Bye-bye.
All right, thank you so much.
Thank you so very much for your call.
Let's take another one. Good afternoon, caller. You're on the air.
All I want to say is darkness cannot drive.
Caller, could you kindly turn down the radio? We're getting a big feedback, and we don't quite understand what you're saying. Could you turn the radio off, please? All right, go ahead now. Go ahead.
Drive out.
Go ahead. Wait. Start from the beginning again. Go ahead now.
Darkness cannot drive out darkness. Only light can do that. Hate cannot drive out hate. Only love can do that. Bye.
All right, thank you, caller. It's just about 20 minutes to 3. Let's take another call. Good afternoon, caller. You're on the air.
Good afternoon.
Good afternoon.
My question to the Honourable Marcella Liburd. I don't be at the hospital often because I have friends that visit up there. I don't hear people that say the hospital this and that and that. But when I go up the hospital up there is very clean. And to me, the cleaners them in the hospital, they're doing a good job because the hospital is very clean, it look clean and it smell clean. And everything is in good order up there. To me, and people say the hospital ain't going this and ain't going that. So I really know what people are talking about because I visit the hospital often because I have friends and so up there. And I see what people really are talking about. And when Terry Adams come on and we just say Timothy Harris I do this and that to 7, Terry he ain't living 7, please to leave us alone because he ain't no going on over here. Timothy not do nothing for 7 because when he in a help 7, tell Terry Adams leave consistently 7 alone. Have a nice day.
All right, thank you, caller. Let's move on and take some more of your calls. Good afternoon, caller. You're on the air.
Good afternoon, Juni. How are you today?
Excellent. Yourself?
Yeah, I hear this whole talk about PAM government trying to form a unity government and collision back in 93. But the whole joke about it, saying that people might not know this. But apparently, I would say apparently, and you do your investigation, Dr. Douglas went to Nevis and reached Nevis before Dr. Simmons to try and get the Nevis government, the Nevis ministers to go with him. So I don't know what this talk about, like PAM was only people who did it. Dr. Douglas went Nevis and reached there before Dr. Simmons. So you tell me, if he ain't sleep on that night, to work out that in the morning he go in Nevis to try and get with the Nevis minister. I mean, come on, man. I mean, that's back in 93. This is 2013. Nothing back in 93 affecting us now other than the people made the wrong move and put Dr. Douglas in there. That's all. And it is not just Pam nor Labour who is complaining. It's everybody. Pam and Labour, even the victims are complaining. So, I mean, let's talk about something more serious and something that actually means something than to go back to 93 and say, Pam did it. Why are you doing it now? You know, Dr. Douglas went to Nevis and reached Nevis before Dr. Simmons to try to get the Nevis ministers to join with him. Imagine that. And now it's all. They want to let it, come on now, let's go up and deal with the thing that we need to deal with it. And stop dilly-dally with the whole thing. It's getting overbearing now, you know? Really overbearing. Talk the truth and say what it is. And then people won't have to come in and correct you in these kind of ways. You know, people out there ain't under that, but certain people under that. Dr. Douglas went to Nevis that morning and reached before Dr. Simmons. So now that people are not, let's see what we're going to say now, or if we're going to just drop this topic about minority and deal with what we have to deal with. We have a vote of no confidence in the House Assembly. That's something that that's present. That's now. If it's half of this population that are upset with Dr. Douglas, that's enough. If 30%, if 40% of the people feel that we should have it, that's enough. Let's go and do what we're supposed to do and stop drying for loose straws. That's my thing. 93 ain't got nothing to do with 2013. Let's deal with what we got to deal with now. That is the whole point.
All right, caller, thank you so much for your contribution. You want to respond?
Just to say that our past is always instructive of our present and our future. So we always have to look to see what happened, not because we want to go back, but because it must be instructive for what is happening currently. And the caller probably was on the boat with Dr. Douglas, so he knew what time he reached.
All right, a few emails. Voice says, Juni, with regards to the land for debt swap, everybody's saying the land gone. Everybody's saying the land gone. But if the government owns National Bank and National Bank now owns the land, when National Bank sell those lands, where's the money going? Back to the government, is it not? So it is a win-win situation for us. That's one. Then Janine says, Juni, the caller, I guess she's referring to Mr. Welsh, was saying that he thought that immediately after the vote of a no confidence, after the vote of a no confidence, oh boy, that is going so fast, the unity government would be put in place. Please tell Minister Liburd to explain that the unity government can only be formed after an election. And first, all of them will have to win. And this will be nothing but pure confusion, says Janine.
That's my understanding as well, Juni.
All right. It's 2:44. The lines are blowing up. So let's take some more calls. Good afternoon, caller. You're on the air.
Hi, good afternoon, Juni. Good afternoon, Marcella. I want to tell you, Marcella, you're doing an excellent job as a minister and what you're doing here on the radio station this afternoon. But I think one of the points that we're missing is what percentage of the lands that are given for the debt swap is that, is given so that people could understand how much of the land is being offered for the debt swap.
All right, caller, thank you so much for that. Let's bring another call. We're going to wrap up in about 5 minutes or so. The minister has an appointment, so let's try and squeeze in another call here. Good afternoon, caller. You're on the air.
Hey, good afternoon, Juni.
Good afternoon.
And good afternoon, Honourable Marcella.
Good afternoon.
I don't want to disappoint you. And I joined late, so I don't know what you were talking about. I just got up. Now, I have some questions for you because I just heard the end part of what you were talking about in relation to people you said have a grievance against Dr. Douglas. That is why the country is so unstable. Now, if you as a member of cabinet, realizing where we were heading, what did you personally do? That's one. Now, some time ago, I made a call, I guess you must have heard, talking about getting some laws in place to help women. It was the single spouse law, the property law. I forgot the correct name. It has to do really, sometimes people are in relationship, one die and the other one has no right. You know what I'm talking about? Is Marcella listening?
I'm listening. Go ahead. I'm listening to you.
You even know what I'm talking about.
You go ahead. I don't know what you're talking about, but go ahead.
No, because I've been as far as the Attorney General to find out if we have the law passed. It has been passed in a lot of countries, Antigua, Barbados, where surviving spouses have rights to property. I've called upon you to get that law in place because our women are suffering. Another thing, down at the gardens, I was told by someone that you went down there and promised to come and do some maintenance work on the building, and all they're getting are promises, and people are not pleased really with your representation, in that you all seem to be more consumed in defending Dr. Douglas than looking after the rights of the poor people. And so in relation to the land, I don't think you understand really what we are dealing with when people are concerned about the loss of the land. It's not a matter of where the money going and who get the money and National Bank. People are not interested in the thing. The same way the money is in the SIDF. That money could have been used to circumvent the situation where we have now. We wouldn't have reached here if you, as a member of cabinet, had opened your mouth and said, look, Dr. Douglas, rather than put the money in what you call a private fund, that money could have gone to the SID, to the consolidated fund and had to pay for the debt. In relation to the school meals, I was told that you I don't know if you're the minister of the school meals, you intend to scale down the program.
I'm not, but go ahead.
But I'm telling you now because we get mixed up with all kind of small talk.
I'll mix up with you, as usual.
And the school meals program, I heard will be scaled down and workers laid off. What about that?
All right, Sylvain, let the minister respond. We're running out of time. All right, thank you.
First of all, I know that I couldn't leave without Sylvain. So thank you, Sylvain. I want you to say how very proud I am of you that under Labour government and under Douglas there's so much freedom of speech, because that was not the case before. So every day you can go on the radio and talk and talk. See how many radio stations we have? That happened under Labour, under a Douglas administration. All these radio stations. So you could go from radio station to radio station every day to satisfy what you like to do best, which is just talk and talk and talk. Talk about things that, of course, any gossip you hear, you talk about, you know. And so I am really not into the gossiping thing. I never promised anybody to maintain any building. But again, you know, you're into the gossiping story. I'm not. And you have a way of trying to put words in people's mouths. So I wouldn't even bother with some of the things you're saying, because some of the things you're saying, I said I never said. But as usual, you know, you'll put words into people's mouth. That is your usual modus. That's the way you operate. And when it comes to surviving spouses living on land, there are many legal matters that come out of these things. And one of the things you have to note with respect to women is that right now, for example, this law you speak about operates in Barbados. And the last time I went there, there's a female senator. They want to get out of it now. Because what is happening is, it's put in at a time when women lived a lot in men's properties for years. And so once the men die, they didn't get anything. What's happening now? More and more women are owning properties. You cannot put any law there for just women or men. It has to be people. So what is happening in Barbados right now is women, they say if you live together for 5 years, you get half the property. So the men moving in with the women in the women's homes and living for 5 years and then getting half of the women's property and then moving out, leaving them with the half. So the women are suffering as a result of that. So we have to look carefully at these things before we go out spouting and talking about them, as happening here, as you know, because of the huge housing program and the focus on making sure that women, especially low-income women, have their own homes. We wouldn't want to have a law, something like that, and then men move in with them, and then they get half or any portion of the property and just leave them after the time frame. Most of the cases in Barbados are centered around whether or not somebody spent 5 years in the house to claim the half. But they're looking for women who have property, move in with them, spend the 5 years, get the half share, and then they move out. So, and be very careful with these things, and we have to look at these things very carefully.
All right. It's just about 9 minutes now before the hour of 3 o'clock. We're going to take a short break. After that, we're going to ask the minister to wrap up right after we come back from this short commercial break.
Convenience and timing are always important when it comes to a gas station, and that's why the Westside Service Center continues to be the preferred choice of motorists in St. Kitts. Located on the island's main road at Buckley's, Westside Service Center offers you more than gas, diesel, and other petroleum products, because their friendly and helpful representatives are always ready to fill you up with a full supply of customer service. At Westside Service Center, they offer other products such as sodas, water, ice, beer, cooking gas, Shell lubricants, coolers for rent, and much, much more. And topping up your cell phone is easy at Westside Service Center. So for your next gas stop, make it Westside Service Center, located at Buckley's. You can also reach us at 465-2165. Remember, when it comes to gas, every time it's Westside.
From you want energy, well we got the right remedy. Run Motel Beverly and Kenny, say a full throttle, we got for everybody. Well, you talking and give one and nothing nah happen. Simba will tell you fi hold a full throttle. Your girlfriend a wait and nothing nah happen. Simba will tell you go hold a full throttle. You yes, you full throttle. 16 ounce of raw energy. We have different flavors and each one tastes fine. Distributed by St. Kitts Bottling Company.
Nowadays, it seems like personal banking is becoming more and more impersonal. But at the St. Kitts Cooperative Credit Union Limited, our roots are right here. And that's why you're like family to us. We are able to tailor our services to suit your personal and business needs. Our savings and checking accounts, vacation and Christmas savings clubs are just some of the convenient services that we offer. Make borrowing fun and easy with our low-interest loans that allow you to borrow funds without the hassle. You get all this and more when you become part of our family. Call us at 465-2272. The St. Kitts Cooperative Credit Union Limited. The best place to save, the best place to borrow.
And we welcome you back to Issues for today. Just about time to wrap it up at 6 minutes before 3. I have a question here about health. Juni, ask Minister Liburd why when a patient is admitted to the hospital, he or she has to pay a 5-day deposit when that patient has medical insurance.
I really don't know why, but I think it has to do with the fact that until the coverage kicks in, that's what happens for the medical insurance. Because unless the person presents their medical insurance on the spot, I think that would be looked at.
All right. Oh, Mr. Liburd, just as you wrap up, perhaps you could wrap up on this thought about the motion of no confidence.
Yeah. The motion of no confidence, that, as you know, is a constitutional construct. That is not something that comes from the people. People don't go out there and say motion of no confidence. It is the parliamentarians. It's a constitutional construct, and it is a tool that can be used and is used. And so, as a government, we have to abide by the Constitution, because that is the supreme law of the land. And so the no confidence motion will be considered. However, the debate and the question at this particular point is, should it come before the budget? Erskine May, that's an author on parliamentary procedure. Yes. That is, from what I know, what they call the authority
on
the Bible on parliamentary procedure.
Yes.
You refer to Erskine May. Under the section dealing with no confidence motion, spoke about, in terms of considering the hearing of it, you also have to look to the exigencies, that's the word used in there, the exigencies on the government's agenda, right? Exigencies, as you know, is just urgent needs, urgent demands, urgent matters. So you have to put it in the context of any urgencies that the government has. I don't know any urgency that is more than making sure that the budget is passed. Because right now, the budget has not been passed, and what, Juni, are the implications if the budget is not passed? What would happen is, because you have a time frame, you have under the Finance Act up to 4 months of a year, which would put us up to April, for when you can spend taxpayers' money without a budget. That means that after that, you won't be able to pay public servants. You won't be able to pay anybody at all from government coffers. You won't be able to provide services at the hospital, whatever they are, anything that you finance, be it drugs, food, what have you. You won't be able to carry out your social services agenda with respect to the food packages and so on that we provide to those who are most vulnerable. And so we strongly believe that the no confidence motion must be heard, but the budget must be heard before, so that the business of government, and government has nothing to do with who is in government, but the business of government, because whoever is in government, public servants must be paid. Right. And all these services must continue for the people. Right. So you have to look to this as the most critical, the most important part of what we should be doing at this particular point in time. Okay. And so for us, it is not that you're not going to hear the no confidence motion, but whether it should come before the budget. And your view is that it should come after the budget? We think that the budget should be heard first because of the nature of the budget and the limitations that you have on spending government money, that people wouldn't be able to get paid after a while. That basically will shut the country down because government services will not be able to be provided because you would have, it's almost something like what you have in the US in terms of, you know, it will be illegal for you to spend the money of the government. And now, even if you were to have an election, Juni, you won't be able to finance it.
I understand. Now, going forward, as if and when the motion of no confidence is heard, and the Prime Minister loses that, a unity government could happen, or elections. The Prime Minister could call elections.
You know what?
Yes.
I prefer to deal with that.
Another time?
No, when we reach it.
When we reach it.
When we reach it. I prefer to deal with that aspect of it when we reach it.
But already there's a lot of campaigning going on as if elections are around the corner.
Well, I mean, because
including in Central Bastia.
All things are possible. In Central Bastia, I welcome my two opponents from PAM.
Who are they?
I don't know who they are, but I hear two young men going around in Central Bastia for PAM, and I welcome both of them.
Okay. Yeah. All right, Minister Liburd, I want to thank you for your time. I want to say that it has been certainly refreshing to get the other side because we get so much, we get so much from the other side and the other side in terms of Dr. Harris, Minister Conda, the People's Action Movement, CCM, NRP, etc. And we hardly hear the Labour voice on radio except that of the Prime Minister. So it was very refreshing to have the press conference organized by the rest of the cabinet to get an insight as to how their ministries are functioning going forward, how they feel about different aspects of development and running the country. So it's good, and I would urge again that we get more of the Labour view on the media houses so that people can get a balance, a sense of what's happening. So I want to thank you for coming in and sharing with us. Any closing thoughts?
Yes, I want to thank all of the callers who called today. I mean, you made the program whatever it was, and so I want to thank you very much. I couldn't end, however, without extending condolences to the family of Gus Williams. He was a radio personality. He also was the carnival chair for some time. So on behalf of the Ministry of Culture, I would like to extend condolences to his family and to extend condolences to the family of the late Pamela Tyson, who passed on Monday evening.
Netball icon.
Netball and sports icon.
Yes.
Pammy, as we affectionately call her, I benefited from her management skills. The two occasions on which we won Caribbean Championships, Ms. Tyson was the manager and the president. She was president of the association for about 25 years, uninterrupted. And I think she did an excellent job, and that is why, in tribute to her, Netball City was renamed after her. As it stands now, I think is the Pam Tyson Complex. And so I would want, on behalf of the Ministry of Sport, Department of Gender, on my own behalf, on behalf of all of the girls, Thelma and Jill and Millie and Jennifer and Carmen and those abroad, Gracie and McMaster and all the others, Hillary, I think she's here, to really say how much we have learned and benefited from Pammy's management, and we want to say how very much we respect what she did for us and for netball and for the country, and we want to extend our heartfelt condolences to her family. Thank you. Marcella
Liburd, thank you so much for coming in and sharing with us this afternoon, and we look forward to when you can come back and again expound on your views of development and governance in St. Kitts and Nevis. Thank you again, and God bless you and the Federation of St. Kitts and Nevis.